Senate Health and Human Services Committee is called to order. Thank you. Appreciate your patience, members of the public who are here today for today's committee hearing. And we are going to get started. If the Secretary would please note the attendance. And without objection, the minutes of March 5th are approved as distributed. Seeing none, so ordered. We are going to start with a presentation first. Healthcare innovation, increasing access and affordability of diagnostic tests for Arizona. And we have some special guests here with us that I'd like to welcome. We do have a little bit of a change in the order of people speaking, and Elizabeth Holmes was not able to be here, who is instrumental in this presentation, but we will excuse her and wish her the best. But we will invite Sunny Malwali, President and Chief Operating Officer of Theranos, to the podium and let us know what is going on in healthcare innovation in your world. Thank you so much for being here today.
Madam Chairman and honorable members of the committee, thank you for inviting us here. For the record, my name is Sunny Balwani, and I represent Theranos, Inc. It's a company based out of Silicon Valley, California, and we are rapidly growing our presence here in this great state of Arizona. For last decade, a group of 300 to 400 scientists and engineers, we have been working on something that we are very excited to share with you, and something that we believe is magical. That's going to improve the quality of care and reduce the cost burden on the taxpayers. We have been working with a mission to make actionable information accessible to physicians and patients when at the time it matters the most. And as you know, a physician's office, when they see a patient, 80% of a doctor's decision is driven by laboratory data. And that data is fundamental in providing good care to the patients. We have been innovating in that area, and we would like to share with you what we have been working on. So if you go to the next slide. We have reinvented how to do lab testing from few drops of blood. This is a big change from what we have seen for thousands of years. The phlebotomy was invented in 1400 BC, and since then the only way people do lab testing is through phlebotomy. If you go to the next slide, we want to show a comparison here. We draw 1/1000th the size of the normal draw today. So today when you go to a laboratory, when they draw out 2 or 3 or 4 or 5 vials of blood, we are able to provide majority of the testing from only 2 to 3 drops of blood. Now you can take those drops of blood using usual venipuncture, but most likely patients will prefer a simple finger stick. And we are able to do that. The unique thing about our solution, if you go to the next page, is the patient experience. And I'll get to the cost in a second, but we really wanted to make sure that we create something that allows a fantastic patient experience. A very large number of people who take advantage of our healthcare services are elderly, and to do a lab testing from venipuncture is very painful. A lot of these people, if you do enough testing on them, their veins collapse. It's impossible to get a draw out of them. In addition to that, children are difficult draw. Same thing with the oncology patients. A large number of cancer patients who are going through chemotherapy become anemic just from the lab testing. And we wanted to provide a better and more human experience around lab testing. Go to the next slide. In addition to that, half of the amount of time that we have spent on this innovation has been reducing cost. And we're very proud and very pleased to bring this technology to Arizona and provide those cost savings to taxpayers and to private citizens. As a reference, I want to point out that if you go for a typical lab testing today, if you go to a hospital or a private laboratory, a test that costs you, let's say, $400, and Medicare will reimburse about $100 for that test. On Theranos' platform, through our laboratory, that number is only $50. So we are 50% below what even Medicare and Medicaid reimburses for the test today. These numbers add up very significantly. Obviously, if you have insurance, this money is passed along to the taxpayers if you are a Medicaid or Medicare patient. But even if you have insurance, a large number of people have high deductible plans. So these numbers are important for everybody who ever takes advantage of lab testing. The next slide. We have some examples here. Vitamin D is a very commonly done test. All elderly people do this test very often. As a reference point, if you were to do this test in hospital, it'll cost you a few $100s. Medicare price for vitamin D is about $40.70. We are providing this test for half the price at $20.36. We have a few other examples here. One of the unique things that we are doing over the next few months is to reduce this price even further. So 50% below Medicare. We believe we are the first company that is actually going to Medicare and Medicaid and saying we will bill you at half the price of what you're being billed today. There are some tests that we are working on that we will be providing over the next few months. We have an example of a test on the next slide. This is a test that detects viral infection. Medicare today reimburses $572 for this test, for example. Theranos will be providing this test in Arizona for $49.95. That's 90% below what Medicare reimburses today. And we think, again, like I said, if you are uninsured, if you are insured, if you have a high deductible plan, these numbers are very powerful numbers. Go to the next slide. We also want to show you these numbers at the aggregate level. What do they mean for the state of Arizona? We have done a projection and cost analysis that if we were the lab, or if every lab were billing you at the same rate as we are billing Medicare and Medicaid, these are some of the savings that you realize. So we believe at these rates, you will save about $2.3 billion for the taxpayers over the next decade. Again, a very significant cost saving. On the next slide, we have some other additional numbers for Medicare. We believe by using these price points, 50% of Medicare, you save about $1.8 billion over the next 10 years in the state of Arizona alone. If we go to the next slide. Another unique thing that we have done is we have published all of our pricing online on our website. Again, this is a very unique thing in healthcare. Healthcare, as you know, lacks transparency, and we wanted to change that. We wanted people to know how much they are going to pay before even they come to our service centers. No surprises. If they are, we have met so many patients who said, I went to the hospital to get a test done, and I couldn't make a payment on my car or payment on my house mortgage, which is why I didn't take care of my health. We believe a good, high-quality, affordable diagnosis is a basic human right. When you create technology that improves quality of care, it must also reduce costs. So those people who need that care the most are the ones who can afford it first. So we have published our price point. We are also releasing an app on smartphones. So before you even come to our centers, you can check in electronically, and we'll be able to tell you exactly what your copay is going to be, what your deductible is going to be, and you can make the decision before you come to our centers what your cost is going to be. So you have transparency up front and on the website. We are also excited that last year, a few months ago, we announced our partnership with a great company, Walgreens. It's the largest drug store in the world, certainly in the United States. And in partnership with Walgreens, we are working to make sure the service centers for our laboratory are accessible to every person within 5 miles of every person's home or work or office. So if you go to the next slide, we announced this partnership. We have already launched this service in Arizona. We have 2 stores already in production. I'll share with you some of the stories we have heard from the patients. But I also wanted to share with you that this partnership is growing, and in a few months, we will grow from 2 stores to many more stores, with the goal that ultimately, if you go to the next slide, we have about 250 plus stores in this great state. So we can provide this service not just in Phoenix, but also to the rural communities. So everybody gets to take advantage of this service. One of the big advantages of working with Walgreens is the accessibility. Again, a very key point. Because our locations are open for longer hours, we are open weekends, we are open in the evenings, we are open early mornings, so you don't have to take time off from work. It's a big factor. A lot of people who can't afford care to begin with cannot afford to take time off from work because they lose their wages, and we wanted to make sure we change that game. So we have made this accessible on weekends and late evenings. Go to the next slide. There are a few stories that I want to share with you and to wrap up my presentation. This is an email that we got from an individual he was a customer of ours. He mentioned that 6 months ago, before my annual physical, my doctor at a local hospital ordered a blood test. I went to the hospital lab, waited in huge crowd, and the standard blood draw. My insurance company refused to pay, claiming they were diagnostic rather than preventive. I ended up paying $500. Today, I went for a lipid profile to Theranos. I was in and out in 10 minutes. They did a finger prick instead of venipuncture, and the total cost was $9.21. And he said he didn't even bother submitting this claim to the insurance company. If you go to the next slide, this is a very special story. A couple of weeks ago, we had a patient who came to our store in Walgreens. This person had no limbs. He had lost his arms and his legs. So when they performed a laboratory testing on this individual, they would take the needle and stick in his neck in the vein to be able to draw blood from this individual. He came to our store. He had a small limb attached to his body. We were able to do a finger prick on him and be able to take those few drops of blood that we needed to do the test. We were able to do the entire lab that he was otherwise going to get done from his neck from those few drops of blood. And finally, here's an email that we received from a nurse. She says, as a nurse in a vascular access space who has seen so many suffer at the hands of earnest healthcare workers working so hard to obtain specimen for the greater good while inflicting greater pain, I pray your technology can be adopted ASAP in all healthcare institutions. What a compassionate technology. And we are very proud that we have brought this technology to the state of Arizona to benefit all the citizens here. Finally, we want to share with you one final point. As we have built this company, we are very fortunate that we have been able to attract some remarkable individuals who have become part of our journey. We are very honored to share that some of the key individuals who are on our board, for example, Dr. Henry Kissinger, who is our former Secretary of State, Mr. George Shultz, he was also a former Secretary of State, Bill Perry, again, a former Secretary of Defense, General Jim Mattis, he's a retired Marine Corps General and the commander of the United States Central Command. He was the person responsible for fighting our war in Afghanistan. Senator Sam Nunn and Admiral Gary Ruffhead, who was the commander of our fleet in the Pacific Ocean. So we are honored to have these people on board. We are very excited about being in Arizona, and we really look forward to serving the people here. With that, our final slide is goodbye, big bad needle. We want to get rid of the needle. With that, that's the end of my presentation. I would like to thank you for your time and open up for questions. If you have any questions, I can answer.
Great. Thank you so much. That was a fabulous introduction to what you're doing, and this information is just, it's overwhelming in scope, actually, and I appreciate being able to have you here to present it. Members, do you have any questions or comments? Senator Ward.
Madam Chair, thank you so much for coming. I appreciate it. I'm a family physician, so I know all of those patients really that you mentioned. I've had all of those types of people. I love the innovation. I love the entrepreneurship. I love bringing the free market to our healthcare system because we do not need to socialize our system. We need to allow the free market to work, and you are just an example of that. So thank you so much for being here and letting all of us know.
Thank you very much, Senator.
Thank you. And Mr. Sesto? Oh, okay. Well, we want to thank you for grabbing onto this technology and doing it in my district. In District 15, I had an opportunity to go to the ribbon cutting and meet Elizabeth Holmes and the executives from Theranos and welcome you to the state and welcome this whole innovation to the state. And so I appreciate Walgreens just partnering with technology for our state and our citizens. So thank you for being here. Did Nicole want to speak? No. Okay. Well, thank you for being here again and for all you're doing in this world.
Thank you.
And please give our best to Ms. Holmes.
I will. Thank you very much.
Thank you. And we will move on to our executive nominations. First, Carol Olson with the Psychiatric Security Review Board. Is she here? There she is.